Dr. Jablecki with Party. I am a family and sports medicine physician. I've been playing soccer since, fourth grade, and I've been using that as my motivation to stay healthy and well for a good chunk of my adult life. My love of soccer stems from the fact that it is the beautiful game. It's played worldwide for a great reason. It's so accessible to anybody. Certainly, it's nice to have a beautiful pitch with a nice goal on it and pretty painted lines, but honestly, all you need is a little bit of space, a rolled up ball of twine, and a couple of things painted on the wall that you call a goal. I think my most memorable game of late has been a couple of seasons ago. We were in the last game of the regular season, coming down to the end of the time. We needed to push it into a tie to go to overtime and then to penalty kicks, and I scored the goal that got us into the overtime play, and then we won in penalty kicks for that game. So it was kind of a feel-good moment for me. It is common for men to have a fear of needing extra care, extra tests, extra hospitalizations, but when they get in and check in with a doctor, too many times I have patients coming to see me well after the time they missed a window to check some screening tests, and usually at the urging of their spouse or some other family member. It's very important for screening in order to get in on time, get these tests performed. The whole point with preventive medicine is to prevent. So you don't want to wait until you have a problem or you've missed your window entirely. So it depends a little bit on age, what kind of questions you should be asking your physician, but in general, for men, it's going to be prostate health is a very common thing. It's one of the male-specific cancers, obviously, and warrants some checking. Usually for most people, we're starting screening at some sort at the age of 50, and earlier than that if there's any significant family history. Other questions are going to be about how should I prevent heart disease, because men start at an earlier age, and that's something we need to be monitoring. And that's what one of the jobs of the primary care physician is to check cholesterol and then also diabetes. What kind of symptoms come on with high blood sugar, and how do we detect that early in between annual physicals and things such as that. A concussion is when you take a knock to the head, and it doesn't necessarily have to be directly to the head. It can actually be a hard fall where your body hits the ground. Enough force can get transmitted through the spine to give a concussion in that sense. The big things for people to know about concussion is that they need to be treated correctly. The risk is repetitive head injury without letting the first one heal properly. That's what puts people at risk for having long-term problems with mood and memory, and we're starting to learn that a lot of long-time NFL players are starting to develop emotional problems late in life, and we're wondering whether that's from poorly treated or poorly managed concussions early in their career. We use some concussion software these days in order to help diagnose and monitor our progress with concussion. And basically what it is a 30-minute long test where a patient will sit down and do a battery of neurocognitive tests, which test memory, reaction time, and a few other parameters that allow me to test whether a patient is having impaired brain function based on the results of the test. There is a lot of data out there to suggest that the more active we stay, the less health problems we have. Pretty much that's the cut and dry take-home point from it, is that the more activity we undertake, we can prevent things like high blood pressure, cholesterol, diabetes, but also reduce rates of cancer. There's lots of things that come on late in life that can be not necessarily completely prevented, but we can reduce the risk. Motion is lotion. For sore joints, achy muscles, overall health problems, the more we keep moving, the less likely we are to stop. And when we stop that we start to lose functionality, we lose independence as we get older. So for everybody, I'd say never stop moving. Okay. To learn more about men's health, go to www.partyhospital.org.